What's going on, everyone? Happy Thursday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, December 7th, 2023. If you are new to my channel, welcome to my channel. This is where we do the daily COVID pandemic update. Yes, it has not ended. And plus, we talk about a whole lot of other viruses: RSV, flu, influenza, pneumonia, and a whole bunch of different things that are going on. Sometimes we talk about new viruses, and as we all know, there is this mysterious pneumonia that is going on around the world. Some say maybe it's a different strain of COVID. Some say maybe it's something else. Don't know. We don't have any news on that right now, but where we do have news on is right here in the United States is where we're going to start off today. Some actually rather concerning news out of University of North Carolina Children's Hospital, where the ICU is at capacity, and they're having to turn some away amid surge of RSV and other respiratory cases, officials say. That's right, they are seeing such a high volume of patients right now. Children, this is a children's hospital, that it's creating a strain on the number of available beds. So this is not good. Then we move over to this up in Canada, and this is some good news. I always try to find a little bit of good news. Here's some for you. Health Canada authorizes updated Novavax COVID-19 vaccine targeting the XBB variant. Ottawa Health Canada has authorized an updated COVID-19 vaccine that targets the XBB 1.5 variant. I know, we're now on BA 2.86 and JN.1 in the United States and up in Canada, but hey, something is better than nothing. Then we move on to this, and this is over in Australia. This is yet again some more bad news. Townsville's public health under pressure as 106 staff test positive to COVID-19. So, yeah, that's a lot of staff testing positive at a hospital. And of course, with 106 people down at one hospital, that is not a good thing. And apparently, this is a very important hospital. It says more than 100 staff at North Queensland's only tertiary hospital are on sick leave with COVID-19 as cases surge in Townsville. So it's the only hospital in the area? Yeah, that's not good at all. Now we move over to this, and it says here, China restarts COVID-19 testing in hospitals and airports. How mysterious. Official directives highlight the coronavirus as one of several respiratory illnesses ripping through the country. Remember, China is a big country, and China, at the beginning of the pandemic, had one of the most strictest lockdowns in the world. So they know what's up. They have one of the biggest economies in the world as well, and they're really starting to ramp up testing again. Raises some red flags of concern, don't you think? All right, coming to my area now in Pennsylvania, Philadelphia area, flu, COVID, RSV cases spiking across Pennsylvania after Thanksgiving holiday. While flu cases are rising in Pennsylvania, most counties are seeing between 50 to 1,200 cases. Philadelphia, it's that time of year again. I gotta read this to you. This is what they put. Philadelphia, it's that time of year again. The sneezing, the sniffling, the coughing, and seemingly endless illness season is upon us. Well, there's only one thing that's right in this statement. Endless illness season is upon us. Yes, it is endless because, let's just face it, it's not that time of year again. We just had that time of year. Did they forget that we just had a big summer wave? Oh, that's right. They didn't talk about it that much. They were really hidden. They more so talked about, oh, the updated booster is going to be coming soon. Okay, let's talk about the fact that we have had, how many weeks now since September? I've lost count, where the United States has had over 1,000 deaths each week, and in some cases, 1,200, 1,300, 1,400 deaths a week. Yeah, illness time has been ongoing since summer when the summer wave started. It dropped a little bit and whoop, straight up again. So, yes, it has been illness time. What a silly statement. But then we come to this. There appears to be a shortage of the RSV vaccine and treatment. This coming from Kentucky, but apparently I had to do a second tweet because I found something else. National RSV treatment shortage impacts parents on the Central Coast, meaning California, but apparently there is an RSV treatment and vax shortage across the country. Some are saying it may be expensive. Some are saying their insurance isn't covering it. Some are having no problems with the insurance, but it's just simply not enough supply available. So there is clearly a problem ongoing with RSV, and yet again this year, RSV is a big problem. I mean, you have the RSV rollout, and what's going on here? It's now the middle of RSV season. It's not going to stop it. The hope is, or at least my hope is, maybe next year at this time, when we come to the winter wave, quote, we're not going to say illness season. We know illness season is now all year round, thanks to COVID being, waves at any time of the year. My hope is next year at this time, maybe RSV is more manageable because of the vaccine and treatment, but I'm not going to hold my breath to it. All right, moving on now. Let's take a look at today's air qualities, and you're going to see much of what you have been seeing. In places where it's cooler, fireplaces are running, you're going to see bad air quality. And that's what the case is here. Pennsylvania, the Northeast, the Great Lakes, but some slight improvement in the Pacific Northwest and the West Coast. Yeah, there's some spotty bad areas, but it's not as dense as it was, so I guess that's a good thing. And we have something going on here in Louisiana yet again. I'm seeing a few sensors that are close to 100 or just over 100. So that is problematic. Then we come over to Walgreens, and let's refresh this. And the Walgreens positivity this week, as we know, did go up ever so slightly. The current week's positivity is 28.7%. The previous week was 28.5%. Difference of up 0.2%. Testing was way up this week. 18,059 tests this week versus 12,757. My hope would be testing goes up every week leading up to the end of the year, since cases are going to continue to rise. There's no stopping now. This wave, it's here. It's happening. It's rising. Wastewater is detecting that the volume of cases continues to go up. It's soon going to go over 1 million per day in the United States. So, yeah, we need to see testing continue to go up, and you're going to see why in just a couple moments, why lack of testing is really becoming an issue, especially in the state of Texas. All right, moving on. Let's take a look at a couple of these wastewater sites, shall we? I want to see what's going on up in North Jersey. I think North Jersey is a very good bellwether of what's going on in the Northeast. Can't show you New York City. New York City wastewater sites not updating. They may be updating on the New York State site. Honestly, I'm not going to try and fit that into these videos. We got so much data and content as is, but look at this. Need I say more? COVID in North Jersey. High. This is in Newark area. 1.5 million population. And this portion at this wastewater site, COVID high and literally going straight up. And we know there's a lot of people that commute between New York City and North Jersey. It's a very high volume commute. If you ever see one of the New York crossings first thing in the morning at rush hour, it's an absolute disaster area with just bumper to bumper traffic. So what's happening in this area is likely to spread between New York, back and forth. So it likely a similarity. And it's just straight up for COVID. RSV is going up. Influenza was going up. Now it's dropped ever so slightly. But again, all three of these are coming up as high. And you can see HMPV is coming up as high. Then we come down here, hepatitis A. There's been detections after detections of that for a long time now. And norovirus at this time, it's in the medium. Overall trajectory was rising though. And let's go out to the West Coast while we're at it. And let's just do one wastewater site on the West Coast because we do have quite a bit more data to get to before we complete today's pandemic update. And let's go to Sacramento. We haven't checked in on Sacramento in a while. And Sacramento at this time, medium for COVID, so it's dropping a little bit at this time. RSV, however, is coming in high. The overall trajectory is upward, but the most recent trend has been dropping a little bit. And it is worth noting here, the values here, when we compare RSV, you can see 50 pathogens, I believe that's what you call it, and then taking a look over here versus COVID. So you're not talking about 300, but still, I mean, look at this. It's a big rise. So it is prevalent in the area at a fairly high rate with the way that they calculate it. And taking a look here at norovirus, norovirus is medium at this time, with the most recently, it's starting to see it went up straight up, then it leveled off a little bit, and now it's starting to go almost vertical again. That's not good to see. Alrighty, that's a couple wastewater sites. We also want to take a look at the latest variants, and I should note, tomorrow there will be a update to these variants. We probably won't. I don't think we're doing a data-filled video tomorrow. It's probably going to be one of those out in the wild videos. So, if anything, we'll likely get this into the pandemic update on Saturday. But here's what the most recent update shows. HV.1 is 31.7%, EG.5 is 13.1%, BA 2.86 is 8.8%. I'm expecting BA 2.86 to be higher and JN.1 to enter the picture. I don't know what level JN.1 is going to be at. I've heard some talk that maybe it'll be around 8%. I don't want to jump the gun. I don't want to throw a number out there and end up being way off, but that's what I heard. We'll just have to wait and see if that is the case or not. And who knows, knowing the CDC, will it even show up tomorrow? Maybe it won't. Hospital admission data. Hopefully this should update tomorrow as well. The most recent shows that 19,444 people were admitted to the hospital in the United States. And you can see here, anywhere that's in this orange and darker shades of orange, that's some substantial increases in hospitalizations for COVID, and that's a lot of counties in this country. I wish they actually said how many counties were in the substantial category. And take a look at this. Puerto Rico. All of Puerto Rico is in substantial at this point. And look at Hawaii. Yes, portions of Hawaii are even seeing substantial increases, and just stable in Alaska right now, which that's actually a good thing to see. All right, moving on now. Let's do some state data and a city data for that matter as well. Let's go to my area first, Philadelphia. 760 EMS incidents reported yesterday. I know some people ask, can I do this for other areas? I actually had a message one day. Someone said, can I do it for other cities? I've looked. It's very rare to see a city that actually posts daily call volume. This is, matter of fact, this is the only one I've seen. If you know of another city in the United States that posts daily EMS call volume, let me know. I would love to report on it. Let's take a look at the suburbs of Philadelphia. Montgomery County, yeah, there's quite a few calls right now. It's 5:21 at night. We're late with today's update, and 16 calls at this time of the evening. Yeah, that's quite a few. And taking a look at Chester County, yeah, wow, a lot of calls right now. Look at this. Respiratory difficulty, 1, 2, 3, 4. Sick person. Dead on arrival, that's not good. And I happen to know someone who had to utilize the ER yesterday. They said it was absolutely mobbed here. Just a few. I mean, our local hospital is under a mile from where I live, and they said it was absolutely mobbed yesterday. So that's not good. Yeah, the hospitals right now, as you saw down in North Carolina even, the hospitals, they're really starting to get busy. It's the combination of virus. It's not all because of COVID. When you have all these viruses at once going up, plus all the other stuff that could happen, someone falls down, someone has a heart attack, stroke, you name it. It's really putting strains on the hospitals right now. New Jersey, 646 people in the hospital right now. That is up a good amount from yesterday's 617. 15 people on a ventilator, 64 people in the ICU, and discharge volume. When hospitalizations continue to go up, the volume, the influx, the back and forth discharges, the plus people going in, it goes up. So 126 discharges, but we would expect that to be high. That just means patient volume at the hospitals are really high in New Jersey right now. New York State, speaking of volumes going up, the volume of cases are starting to go up. 3,774 cases in New York State report today. That is up a good amount from yesterday. Hospitalizations, yes, when you start to see a faster rise later in the week, today being Thursday, that's not a good thing, and we're seeing that now in New York State. So the rise in hospitalizations is starting to become more significant. 1,636. The clue that this gives me is that next week when New York State will start its new week. We'll get one more day of data from New York State, but next week when they start the new week on next Tuesday, I suspect we're going to probably see somewhere between a 200 to 400 increase in one day. That's just my guess, because the volume of cases, it continues to rise, and you can see when you have a big rise on a Thursday, yeah, that's never a good thing. All right, taking a look here at Massachusetts now, 14.1% of all ER emergency department visits are for some sort of a respiratory virus, whether it be COVID, influenza, RSV, pneumonia, tuberculosis, you name it. It's an issue right now. Let's go to the Great Lakes. Let's go to the big city in the Great Lakes, Chicago. Yep, hospitalizations are rising there as well. They're up to 22 now. That's up. Emergency department visits, they're up. Hospital bed use is up. Laboratory confirmed cases now up to a daily average of 230. That's just in laboratories. That doesn't include at-home testing. And as we know, it is expensive to get a PCR test if your insurance doesn't cover it. So it's likely way high, multiple times higher than that would be my guess right now. Deaths percents, yeah, they're starting to go up as well. Total number of people vaccinated. Look at this. Wow. Vaccinations in the past week. 10,760. Now, Chicago's a big city, but that's a good number to see go up. Now we come to what I was talking about before. The state of Texas, where we do run into problems with testing. Take a look at this. Testing, or the number of cases in Texas, is way down. And you're probably thinking, well, isn't that good news data report? In a way, yes, you can look at it good news. I don't look at it as good news. The only thing I see here is testing is down. Let me explain. Current week's cases, 5,974. Previous week, 8,212. But there's more to the story. Number of fatalities, well, first off, they're up. 50 versus 47, that's up by 3. But take a look at the hospitalizations. They had a pretty big increase, up by 205. 1,165 versus 960. What's that telling me? There's not enough testing going on in Texas. People are either just not getting tested, it's the at-home test, and they're not reporting it. Whatever the case may be, the hospitalizations going up this much tells us that, in actuality, cases are probably really rising in Texas. And that's with a lot of hospitals now not even bothering to check and see, oh, maybe what you have is COVID. Because I've known people who have had to go to the hospital. They have had these random illnesses, and the hospital doesn't even test for COVID. So without all the hospitals being required to test, hospitalizations still went up. Yeah, that's telling me I'm not buying this drop in cases in Texas whatsoever. However, there is some good news. How about we end the day on a little bit of good news? Colorado. The number of people in the hospital actually dropped this week to 257. It was 267 last week. Hey, a drop's a drop, and I am hearing from people that it's actually influenza and RSV that's becoming a problem in places like Colorado, Arizona, and a couple other states. And after a really long period, I mean, look at this. You got to go back into August. That's the beginning of this chart. It's been since August since they've actually seen a sustained drop. So you can see here, 2 weeks in a row have dropped. Yes, they did have 1 week back at the beginning of November, but hey, a drop's a drop. Do I think it will last? I think at some point they will likely go back up again, but hey, take the good news when you can get it. Alrighty, folks, that was a lot of news and data today, wasn't it? Guess what? We're going to do it all again tomorrow. I'm not certain it's going to be a data-filled update. It may be an out-in-the-wild update. You'll just have to check in tomorrow and see what I post. If you learned anything in this video or liked this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. I will see you all again next time. But until I see you again next time, stay safe, comment if you have anything you want to say, share this if you know anyone that needs to see this content. See you all again next time. Thanks for watching, and have a fantastic Thursday night. Bye-bye.